Hi, I'm Kelly O'Donnell. I'm one of the Freedom at Home team and AmeriPlan's National Vice Presidents, and I'm here to talk with you a little bit about our Med Plus program today. This program runs $24.95 a month with a $20 registration fee in the first month. Now, the program is month to month, meaning the client doesn't need to stay on long term. It's every 30 days the contract renews. And the client can have one person in their household or 10 or 15. It doesn't really matter. A household is everyone under the roof, which is nice. We're going to talk a little bit about the frequently asked questions your clients may have about our program today, as well as each portion of our plan and how it values them and you in your conversations with them. So let's get started and talk about telemedicine first. The telemedicine part of our program is really unique in that you have a doctor on call 24/7, 365 days a year. You can call, you can ask questions, you can say, hey, my daughter has a cough, it sounds really bad, not sure what to do. You can ask questions for free anytime that you'd like. Through that telemedicine program, they've also got a line that's called a diagnostic line, where you can call in and for $25, you can get diagnosed by phone and receive a prescription, get it sent right off to your pharmacy for AmeriPlan to discount your prescription as well. Now that diagnostic call costs $25 a call. They can diagnose things like ear infections by phone, eye infections, bladder infections, things that you might get like by way of flu or coughs or things like that. My son had a burn on his wrist. He works as a barista in a coffee shop, and I sent in photos online, and they looked at the photos and they prescribed a cream by phone as well. So this $25 fee that they charge is often a little less than what somebody might have to pay if they were going to a doctor's office to get a diagnosis on a very expensive insurance program. If you take an expensive insurance plan, hundreds and hundreds of dollars a month, and you pay a $30 copay to go to the doctor to get the same sort of service, it's really nice to have a $24.95 a month plan where you can call in for $25, get diagnosed by phone, and you don't have to be involved in the doctor's office waiting area. You don't have to miss work to get that prescription taken care of. You can just get it done by phone within an hour or two of when you call in initially. So it's a fantastic add-on to our program. In using the telemedicine, you may get a prescription called in from the doctor that you've called in with, and that part of our program is also discounted. So you can go to any pharmacy in our network and receive a discount on medication. Now, Pharmaceutical is the most volatile part of this plan and any plan, even if you're on an insurance plan. Because if a pharmaceutical is made only by one company, let's say the drug doesn't have a generic, only one company has cornered the market on that medication, they can charge whatever the heck they want to for that drug and they get it. And so there's very little wiggle room for a discount there. If that drug is made by more than one company, we get a discount based on the competition that's available, if you will. And if that drug has got a generic or is made by more than two companies, we've really got a competitive edge in being able to get that drug at the most discounted price available. And so depending on the medication, is how our discounts are sort of created. And so for some drugs, we do fantastic, and it's worthwhile to check them in your pharmaceutical locator in your back office. Your clients can check it at AmeriPlan.com, and we'll talk about that at the end of the video. Oftentimes, clients will ask me, can you use the pharmaceutical part of our plan alongside the pharmaceutical plan that you've got with your insurance already? The answer is no. The pharmacy will take one or the other of your cards, and you can have both on file with your pharmacy and allow them to run it both ways, which takes about a minute. They run it both ways. You pay the cheaper price. My kids are insured, and they do have both cards on file. I will always ask the pharmacy to run it both ways. Half the time AmeriPlan's cheaper, half the time their insurance is cheaper, and then obviously I pay the lower price, which works out great. Moving along, let's speak about the hospital advocacy part of our program. Wow, is this thing great. Most people don't get insurance for the day-to-day things that happen in their world. They don't get insurance to run to the doctor or get the insurance in the event that they need to go get their mammogram, because those aren't the things that are breaking the bank, and insurance is hundreds and hundreds of dollars every month. What AmeriPlan does in the event of an emergency, if you go to the hospital and you've got bills that total over $1,500, our advocates will go to bat for you to get the lowest price that they can on those visits to the hospital. Now, how does that work? You go into the hospital as a cash patient. If you go in there and say, hey, I have AmeriPlan, they're not going to know what that is because we work through an advocacy company on the total cost of the bill. So you enter as a cash patient. You tell them that you pay whatever you need to pay to get out of there, which is usually $100 to go home, and they'll bill you for your services. Most hospitals don't have a chart right there and say, oh, the services today are going to cost you X amount of dollars. You generally have to go home and get your gigantic bill. So you pay what you have to pay to go home, again, usually about $100, and then you will call our advocate. Our patient liaison will help you get set up in the system, and once those bills start going in, you're going to send them to your advocate. Our advocates save our patients somewhere in the neighborhood of 80% on average, which is an incredible discount on services at the hospital. They will go to bat for you and make sure that that hospital isn't jacking up the prices in areas that they should not, and get that price down to something that our patients can afford. So it's a fantastic addition to the program. If you've got past hospital bills, which is something that it didn't used to cover before, and it does now, if you have a past hospital bill that you're paying on that's over $1,500, they will go in and negotiate to lower that bill for you as well, which is great. Now, hospital advocacy works on a per case basis. So say you break your arm and you go in and it's $1,800. They will advocate that broken arm for you. If you go in at another point in time to get a chest x-ray for pneumonia, for instance, the two are not related, and they have to both be $1,500 before they will be negotiated. If it's all related to the broken arm, then you will have all the services under the same umbrella to get the discounted rate by way of the advocates. So hospital advocacy is great to me because if you look at insurance, people pay hundreds and hundreds of dollars every month just in case something happens to them. When that adds up over a year's time, you're talking about $8,000, $9,000, and $10,000 a year just in case. Well, our advocates go to bat if you are in a position where you've got a $1,500 bill. Our advocates will go to bat to discount that fee for you so that you're just not going to lose the farm, if you will, over a hospital bill, even with our plan at a lower rate than an insurance plan might be at $24.95 a month. Let's talk about the ancillary part of our plan, the labs, the x-rays, the MRIs. It's a fantastic addition to round out this package in that our labs are drawn by a company called MedStat. And what ends up happening normally when you are on insurance is you'll go to the doctor, you'll pay your copay at the doctor and your monthly fee for your insurance plan, which is usually hundreds and hundreds of dollars. Then the doctor will prescribe you a lab slip. And then you take that lab slip, you go to the lab, get your labs drawn, you're going to pay your rates to the lab, you're going to then go back to the doctor to get those labs read, which winds up being 2 visits when you already sometimes know you need certain labs drawn. I know that every year women go into the doctor for their annual OBGYN appointment and they always get the same labs drawn each and every year. So you can call MedStat, they have a doctor there that will order your labs for you. So you call in, you get your labs ordered, you pay the rate for whatever the labs are you're getting drawn at a discount, and they will schedule you with Quest or with LabCorp, and your bill will be zero on their end because you will have already paid with MedStat. Now, what ends up happening afterwards is fantastic. So they don't call in your labs to your doctor unless you want them to. They have a doctor there, and they will also send your labs to you. So you can get them read by the doctor at MedStat, but you can also get them read yourself, so you can take that, and if everything looks normal and you're in the normal range, well, you don't have to go back to the doctor to find that out at an additional cost, which is fantastic. I love working with huge companies like LabCorp and Quest because they're all over the country. They're in small town America, Our plan can really save people money all over every little nook and cranny of this country. And going back to the hospital advocacy part of our program, those discounts apply at every hospital in America. They'll even go into Kaiser's and veteran hospitals as well. So really that is in all little parts of the country. The pharmaceutical plan is accepted at the big pharmacies, the Walgreens, the CVS, all the big grocery stores, sometimes Costco, sometimes Walmart. On the MRI part of our plan, you're going to get your discounts ahead of time. You're going to know exactly what you're paying when you get in there to go do your MRI. I had a fantastic experience with an MRI done on my knee. I was impressed with the facilities. They were clean. They were very professional. I had already paid. I went in, got the MRI done at a fraction of the cost of what it would have been if it was out of pocket. It was really nice. And when you talk about x-rays, depending on what you're having done, the discounts range anywhere between 30 and 55, 60% off. So it's a really fantastic addition to round out this Med Plus program. Now, sometimes your clients will ask you questions like, can I go see my doctor on this plan? Or can I go see my specialist on this plan? And the answer is no. You're not comparing apples to apples when you're talking about a doctor and a specialist visit and hundreds of dollars for insurance when you're talking about a $24.95 a month medical discount package. So when somebody goes to a primary care doctor, how often do they really go? Once, twice, 3 times a year, depending. If you tell your doctor, hey, I'm a cash patient, you're going to receive a discount anyway. And so that works out in your favor no matter what. And so AmeriPlan put their resources into the more expensive parts of the program. You get sick, you go to the hospital, you're going to maybe pay $10,000 as opposed to a $70 doctor's office visit. So we put our resources into discounting the services that cost more. The labs, the MRIs, the x-rays, the pharmacies, the telemedicine kind of takes over that place of the primary care doctor, if you will. And oftentimes we see our specialists once a year and get normal routine work done. And those sort of things, you can ask for your discounts direct with the provider. A lot of times our clients will ask us, can I use this alongside my insurance? The answer is yes and no. We're not competing with those $20 copays, those $30 copays. If somebody is paying a copay at the doctor, they are probably paying a large amount of money each month for the insurance plan that they've got in place already. AmeriPlan is really designed for the people who are in that donut hole, people who are above the Medicare line that fall out of the system but into a place where they can't afford insurance. Our plan is great for people who have a high deductible insurance plan. If you've got a $5,000 insurance deductible or a $7,500 insurance deductible and you go to the hospital, you can use AmeriPlan to lower the rates on anything over $1,500. So that is very valuable. But we're not looking to compete with the copays or lower people's copays. In the event that somebody has a plan that's doing that, it's not a great fit for them. But if somebody has a plan with a high deductible, people who don't have insurance, people who fall under that amount of money where they can't qualify for Medicare or Medicaid, but they can get insurance, that's a great market for us. Now, our clients who use this plan have lots of great things to say about it. If you go into your Save with Discount Healthcare website and you click on the testimonials, you can see what other people have to say about the program. And as you're marketing to your clients, you might share some of those stories of the savings other people have as well. For your clients, if they want to log in, once they're a member, they sign up. The day they sign up, they can't log in, but 24 hours later, they can. They can go to AmeriPlan.com, log in up top where it says members. That'll click that in and take them to the membership portal. They can log in there with their member ID number, and their password is going to be their zip code the first time they log in. Then they'll ask them for a more secure password, and they'll get in there and be able to print temporary cards for their plan. They can use the plan right away for most of our services. They can go in, they can call telemedicine once they're in the system. For the hospital advocacy part of our plan, they need to be a member for 3 days before they can use it to advocate services. But it takes 7 to 10 business days for their plastic physical cards to make it to them in the mail. So they can log in online and they can print temporary cards. They'll also see, there'll be a little link that says telemedicine. They can click on that and they can see the telemedicine portal, the phone number that they can call if they want to set that up. They'll see all the pharmacies in network back there. They'll see all the MRI facilities and the labs and how to use all of that stuff right in their back office. So once they sign on, teach them how to use that so that they can get in and start using the program right away. I'm a big fan of this part of our plan. I hope that this video has helped you to understand the questions that your clients might ask as you go. Thanks so much. Have a good day.